Greetings. My name is David Marcovitz, and I'm an addiction psychiatrist at Vanderbilt University School of Medicine, where I'm also an associate professor. I wanted to share this message in recognition of May being Mental Health Awareness Month. And because I'm an addiction psychiatrist, I wanted to share a pearl related to the prevalence of addiction and how to notice if you or someone you love is dealing with an addiction. First of all, we know that addiction is very common, and of the Americans dealing with any mental illness, um, actually about 2 out of 5 of them will also have a co-occurring substance use disorder, and about 20% of people will experience an alcohol use disorder in their lifetime. That's not to mention other substances that people can be affected by. So when it comes to recognizing a substance use disorder, we think about the 3 C's. And the 3 C's are a way of remembering how to know if someone's developed a problem with a substance or behavior. The first C stands for compulsion or loss of control. And that's when a person continues to use a substance or engage in a behavior despite having problems related to it or wanting to stop or wanting to cut down. And so we remember that as the first C, loss of control or compulsion. The second C is actually related to consequences. And so when people start to notice that in relationship to a substance or behavior, they're having problems with social or occupational functioning, could even be that they're noticing problems with their health or spending more money than they had previously, we think of that as a consequence, and that can also be a sign of a substance or behavioral addiction. And finally, the third C is for craving. And craving I use to remember not only cravings or urges to use a substance or engage in a behavior, but also it reminds me about some of the physiologic signs of addiction, which are tolerance, where more and more of a substance or behavior is required to get the same effect, and withdrawal, where abruptly stopping a substance leads to a syndrome of symptoms that can be quite distressing or even dangerous in the case of some substances. So compulsion, consequences, and craving, those are the 3 C's. And they, of course, are much easier to remember than the 11 criteria in the Diagnostic and Statistical Manual, but they can be used on yourself, on a loved one, or by a mental health practitioner to screen for a substance use or behavioral addiction. So I wanted to share that pearl. It's important to be aware of the risk for addiction and to speak with a mental health provider or other professional primary care provider if you think you may be struggling with an addiction. For too long, stigma has caused people to hide these behaviors in the shadows and feel that they can't talk about them. And I'm grateful to see that that's changing in our society. So with all that said, I'm wishing everybody a very peaceful Mental Health Awareness Month.